Good evening, everyone, and welcome to the second of 5 video lectures for the online UWC Fall 2014 Sustainability course. And I'm very pleased to present here Mitzi Laszlo, who is going to be talking to us about topic 5, achieving health and well-being for all. And Mitzi is both a mentor on online UWC, and also she's worked as a neuroscientist for a Brazilian epidemiology study, and she's funding a preventative healthcare company called Init, which she's going to talk to you about this evening. So without further ado, I'll hand over to Mitzi, and remember, as with last week, to ask any questions in the Q&A feature, and we'll deal with them at the end. Mitzi, over to you.
Hello everyone. I'm going to talk to you today about health, which inevitably means we're going to talk about death and disability. So let's start on a positive note and look at what's happened in the past 200 years. Hopefully you've watched the online video clip of Hans Rosling on Gapminder, who is fantastic, as are his other videos. Let me share my screen with you. Okay, so as you saw, in the past 200 years, we've been getting massively healthier and massively wealthier. So things are looking good. I mean, we used to die very young, and we used to be very poor in this corner. And it's moved up into the top right, healthy, wealthy. How do you measure health? Lifespan is what we usually talk about, but there's also quality of life. So you've got disability, adjusted life years, which is a WHO term, which measures the gap between the current health status and the ideal health status. So there are various measures. There's also a lot of places where you can find data. And I'm going to give you a few tips on where to find good data. I'm a neuroscientist, I work in research. It's very important that you look at good data, quality data. One place is the World Bank data page. They have fantastic stuff. Have a poke around, it's beautifully presented. The other place is the World Health Organization, which is obviously more health related, although on the World Bank there are health indicators. The CIA World Factbook, also beautiful. And Hans Rosling, who's got a page called Gapminder. He has several videos explaining excellent data and breaking a lot of misconceptions. So it's well worth having a look. Okay, so we've understood that health has been improving, but we're still dying of something. So what are we dying of? On the World Health Organization page, you can see the top 10 leading causes of death. This is for 2012, which is nice and recent. Leading, by far, is heart disease and stroke. And here you can see the number of people that have been killed by these diseases in this year, 2012. Following, we have 3 respiratory-related causes. So these 5 top causes fall into a category called non-communicable diseases. And that's different from HIV, the 6th cause, which is an infectious disease. This is a big difference. So Ebola would be an infectious disease, and a non-communicable disease is something like diabetes or heart disease or stroke. It's a result of your lifestyle. There are 4 factors of lifestyle that dramatically increase the risk of getting an NCD or dying of one. The first is tobacco. The second is an unhealthy diet. The third is physical activity, and the last is alcohol. So it's pretty restricted in these behaviors, but You can really modify your outcome with these 4 behaviors. So why are we doing what we're doing? If we know this, why are we still suffering? It's a tale of 2 deserts. So you get a normal desert, as we all know, and then you get a food desert, which is a geographic area where affordable and nutritious food is difficult to obtain, particularly for those without access to a car. This is particularly prevalent in America. So this is a food desert. This is a week eating in a North American family. You can see there's a lot of processed food. So this is not helping us at all. If we look over time again, so this is not to scale, but on the x-axis you can see time. So this is 20 years ago, 10 years ago, and today-ish, and this is increasing. Communicable diseases in red are decreasing. We've made a fantastic effort, and it's worked. The problem is that non-communicable diseases have increased over time. So, numbers. We've got 7 billion people in the world. In 2012, 56 million people died. 68% of that 56 million died of NCDs. That's huge, 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 huge. And to put that into perspective, if you clump communicable diseases, maternal, neonatal, and nutrition conditions together collectively, they're responsible for 23% of deaths. So it is a big factor at the moment. This is today's topic. It's related to wealth. This is a map of Toronto. The blue indicates low levels of diabetes, which is an NCD, and the red indicates high levels of diabetes. Around the middle, you can't see as much diabetes as around the edge. And around the edge of the city, you get poorer neighborhoods with less access to options for healthy living. So there is a geographic distribution, and there is also a economic distribution. This is also true in the world. If we look at developed regions, 77% of people died of NCDs, which is a lot less in developing regions. The thing that you can't see from this picture, this is a static picture. If we look at a photo and the rates of increase, NCDs are increasing big time in developing regions, particularly places like Brazil, China, Africa, where people, and rightfully so, are being pulled out of poverty, but at the same time are adopting westernized modern living, which leads to NCDs. It leads to no movement and too much food and too much alcohol and tobacco. So this is a problem. Why? In developing regions, there is not as an established healthcare system. So there is no infrastructure to deal with this vast quantity of problem. Bringing us on to universal health coverage, which is a term coined, again, by the WHO. It was brought up in the UN Sustainability Goals. The idea is that people should receive health services, but without suffering financial hardship. So if you look at the world, 1 billion people suffer each year because they can't obtain health services they need. And every year, 100 million people are pushed into poverty because they have to pay for health services directly. Health is something which happens suddenly, and you have to somehow distribute the cost over time, either through insurance, which the idea is to spread the risk, so you don't have to deal with a massive payment in 1 year. In essence, it should work. Or through a government system, where the government takes some taxes and provides a health system which you can tap into. I want to draw your attention to the complexity of sustainability. Healthcare is not in isolation. Reducing inequality through economic empowerment, but also social empowerment, are linked to sustainability in health. And lack of access to healthcare can also pull people down into poverty. If you don't have healthcare coverage, you become poor. And if you are poor, you're more likely to suffer health problems. So it's a cycle. One of the most heartbreaking misconceptions we have, and Hans Rosling is going to tell us more about this, is that we shouldn't help the poor people to get out of poverty because we will have too many people in the world. This isn't true. Child mortality rates are directly correlated to how many children women have. The poorer you are, the more probable your baby will die, and therefore you'll have more children to compensate. We really do have to pull the bottom billion out of poverty for our own good. The best contraception is female education. So health is connected to economics, which is connected to education, which is connected to women's rights. And the circle continues. We need men and women to work towards a society that's equal for girls and boys, men and women. That's harder than you think. We have so many misconceptions without even wanting to. There's a very good film, which I put the link in the reading material, called The Majority is Oppressed, and it's a French movie that switches gender roles, and you can see how uncomfortably unfamiliar it is when women act the same as men. This is a Hans Rosling video. I really suggest you watch it. Will saving all the poor children lead to overpopulation? The answer is no, but he has a very good explanation of it. I very much recommend it. So inequality. This is a trust, the Equality Trust. They give data about inequality. If you look at infant mortality, it's higher in unequal countries. So is mental illness and obesity. The Gini coefficient is a measurement of equality. So if you look at this line, 45 degrees, that's when the wealth is evenly distributed between the whole population. The more you deviate from that line, the more unequal you are. There's a book, it's called The Spirit Level. It's well worth watching. Talks about inequality. So what I want to stress from this research part of this lecture is the complexity of health and sustainability, that issues are linked, and to help ourselves, we must help each other. Things have been getting better over the past 200 years. So yeah, have a look at the data. There's all these sources, have a poke around. That's the research part. I'm going to talk to you a bit about innovation in healthcare. At the moment, we track our cars very carefully. We don't wait for an accident to happen. We measure every single possible thing to prevent an accident, and we intervene before the accident happens. So what's happening in health is tracking. We have pedometers on our phone, we have shirts that measure your heart rate, you have a lens that you can use as a glucose measure, you have wristwatches that tell you about your stress levels or how well you've slept or your heart rate, etc. So there's an awful lot of monitoring going on. There's another link I sent you about a documentary, several documentaries, but particularly one about innovation. There's a lot going on out there. There's a competition called the Qualcomm Tricorder, and they're offering $10 million to stimulate innovation in tracking devices. So have a look. They're online. There's also a lot of accelerators and incubators. So if you have an idea, feel free to reach out to me, and I can point you in the right direction in where you can find support. Or if you have any questions about research, also I can either answer your question or put you in touch with the person who could answer your question. This is how you'll find me. I'm on LinkedIn, Facebook, everything, or you can just email me. So that's the big picture. I hope you enjoyed the big picture, and I've set a few questions as homework. The idea is, more than anything, that you have a good look at what's out there in information and try and apply it to your region. See what's going on. If you have any questions, go ahead.
Great, thank you so much, Mitzi. I think we'll just start with the questions from the students on the side here, and I also have a couple of my own because it was such a fascinating topic. So let's start with Marie's, since it has the most votes. Marie's interested to know, would prescription drugs, even though they are supposed to help the consumer have better health, be considered also bad for health? So how effective are prescription drugs on reducing or increasing lifespan or increasing the healthiness of the population?
Okay. There's a book. It's called Bad Pharma. It's an English guy, Ben Goldacre. I'm not sure how to spell his name. But it goes into that debate. There's a lot of incentives in pharmaceutical research which are twisted. So if you look at publicly funded research, it's usually less favorable towards the drug than research that is funded through pharmaceutical companies. That's not to say drugs are bad. Without drugs, we don't have medicine. So I would definitely not say stop taking drugs. There's a lot of research going into it. They say that a lot of lives, that increased trend we saw is largely due to innovation in drugs. So pros and cons. You can look deeper into the issue with Ben and Bad Pharma. He's got another one called Bad Science, which is about statistics and how you can twist it to fit your story. But yes, without drugs, there's no medicine. So drugs are not all bad.
Thanks. And next we have Jose's question. Do you think that a good Gini coefficient inside a capitalist society will objectively tell the extent of equality within that society? It's so I guess how effective is the Gini coefficient in actually showing whether a society is equal or not?
Yes, it's pretty good. It's pretty good. All indexes have flaws, and if you look at one index, you're more likely to have more flaws. So your best bet is to look at various indexes. The Gini coefficient is designed specifically for distribution of wealth. There are a few more. There's one topic of health that I didn't touch upon because I didn't have time, but it's happiness. So there's been a lot of research recently into happiness and how to make a happy society. That's also important. There's also corruption. The Corruption Perception Index gives an indication of how corrupt people feel their own country is. It's very difficult to measure corruption because you can't go around and say how much money did you receive for corruption. But yes, all indexes have flaws, but also they're pretty good. They're pretty good. And the Gini coefficient is very widely accepted. It's a good indicator.
Okay, great, thanks. Next, well, let's the next question is from Marie again. It's about, okay, so if women get access to education and go to work in countries where women are generally less equal than men, what could be the effects on an economical point of view? So I guess, yeah, is there an overabundance of workers, and could that actually work against the improvements in healthcare that are normally seen through women receiving education? I think she's just asking out of a playing devil's advocate point of view.
Yes. Education sends things up, and especially equal education. So what happens in many countries is that boys are sent to school and girls are not. And this happened in Europe very recently. My grandmother didn't go to university. She did go to school, but she didn't go to university, and my grandfather did. So this happens. It's happening a lot less in Europe, but it still happens in a lot of places around the world. And it's one of these spin-off effects. Giving women education is so important, also, not only morally, but also for economics. If you have 50% of a population working, you're just not going to reach the same level as if 100% of your population is working. It's just not going to happen. It's also about contraception. So if women are educated and have goals other than producing a family, they're a lot more likely to have less children. And we need to reach a point where we're having less children. If we all, rich families, have 2 children, and by rich, I don't mean it's very, very rich. I mean pretty much the average European family has 2 children. That's rich, relative to the world. The average poor family has 5 children. If you have 2 children, you replace yourself, because you have a man and a woman and they have 1, so we have a sustainability of our population. If you have more, you're growing a lot. So at the moment, if everybody has 2 children, we're going to reach a point where we have 10 billion people. If we wait, we're going to have more than 10 billion people, which is obscene. There is a limit. We don't know what the limit is, but 10 billion is a lot. So the quicker we pull people out of poverty, and the quicker we teach our women, and the more we get people out of poverty, the better economic movement is going to go forward, and the more sustainable we're going to become. So yes, educate your women.
Thank you. So next we have a question from Lucia, who asks about well, why don't we invest more work on preventing illnesses, and she's wondering whether that pharmaceutical companies actually don't want governments or societies to invest in this because they actually make a lot of profit from treating the illnesses after they've happened. Yeah.
Interesting question. It's what I work in, so I'm passionate about this. People aren't bad, but the system is designed for a different situation. We saw that health, communicable diseases, infectious diseases have gone down. And our medical system is designed to treat infection. It's designed that if you get a symptom, you go to the doctor, and the doctor is paid to treat. But nobody pays you to avoid treatment. And at the moment, we don't actually have a cure for obesity. And sort of limited cures or control for things like diabetes and cancer and stroke. So our only real solution is prevention. And yes, the incentives are skewed. But perhaps in the future, pharmaceutical companies won't produce necessarily a pill, like a sort of conventional drug, but will get involved in an app that will rewire the brain, which will change habits, for example. Maybe pharmaceutical companies will just approach it differently. In the end, we need pharmaceutical companies. We need hospitals. We need institutions that provide medical services. But we also need to shift the incentives within these medical services. We need to be paid to be healthy rather than paying to avoid sickness. So yes, I think we will see this. It'll happen. But we're stuck in a bit in time because 10 years ago it was a whole different world. So there's a lot of reinvention going on.
Sure. On that note of I guess getting the different companies involved, and I wanted to, when you mentioned about the tracking aspect, Oscar has asked a question about the nature of tracking, and he asked, which is something I was also wondering about. Do you think that the tracking of our activity and bodies is it necessary to this preventative health? And making us healthier? And then I guess also I'm also interested to know what are your, like, you know, do you have any ethical issues with the mass collecting of data, or could there potentially be ethical issues with such intimate details about people being recorded?
Very good questions, fantastic questions, and very pertinent to discussions which are happening now. The first question, is it necessary to track? Yes. There's a team, I think they do rugby, and they've been tracking their players while they play. And they saw that before they had an injury, they tended to slow down, move around less, and then, lo and behold, they'd have an injury. So what they started doing is pulling players off the field before they had an injury. The idea would be similar in us, in normal people, not just athletes. If we could see a heart attack coming and intervene, we'd have a much greater chance of not dying and minimizing the impact. Or if you could detect cancer early, and there's some fantastic new technology on cancer detection. There's breath analysis, where you breathe and it detects a tiny little chemical molecule, and it suggests that you might start to have cancer. And cancer is not a death sentence anymore. You can treat up to a large point, but you have to get it early. So if we track, we're just better equipped to deal with it. We're not responding soon enough. So yes, tracking is necessary, or it's necessary to prevent. You need to know where you're at and what's going to happen in the future. And to know what's going to happen in the future, you need to know what's happening in the past and how that's changing. So yes. Second question, data privacy, big issue. In it, the company that I'm doing, that I'm funding now, is working on this issue. The current model is a platform where you dump all your data. And people like Facebook or Google, you get value, you extract value from that business model through that data, through owning it, because you can predict trends. The problem is that a lot of that data is in the States. Simply because the companies that are based on the internet are in the States, and the US made the internet. It's just a chance thing. It just happens that Google is not Danish, you know? There's no alternative that we all use. The problem is that the law in the US protects citizens, which means all Americans and not non-Americans. So we're not in this, the Europeans. You probably saw recently that Merkel got tracked, as did Dilma in Brazil, through a spying situation. This was taken as a huge offense, and Europe is now seriously getting involved in creating a sort of barrier around Europe for data protection. I heard also recently that Iceland is talking about becoming the Switzerland of data protection. So in Switzerland, you can hide money, you can put money there without saying where it came from. And in Iceland, the idea is to create a containment of data which hides your identity, and you don't have to say where it comes from or where it's going. I'm working on a model where you are the owner of the data and you become the trader of your data. I want to switch the model because I think, particularly in health, people are quite sensitive about putting all their data in one place. There's another documentary by the BBC Horizon called The Dark Web. Great. Definitely watch it if you're interested.
Okay, great. Thanks. Well, you mentioned about, I guess this is quite a European, particularly because the ability to track the data is much easier in developed countries. But what I was interesting, and Teresa has also asked a question about, I guess she's asking about Ebola and why developed countries are so interested in saving people from their own countries, but they don't seem to be doing an awful lot to help the situation in the developing countries. And I think I would be also interested to expand on that and what are the what are the implications of these trends that you've identified of the non-communicable diseases in developing countries as well.
There's a book, it's called Dead Aid, by Moyo, and it talks about how giving things perhaps causes more harm than good, that charity is not necessarily the solution and we need trade, not aid. We can help developing countries mainly on thinking along this philosophy, which is what I mean. These are political issues, so you have opinions, you know. My opinion is that we should be trading, not sending things to Africa and hoping for the best or wherever. We have a lot of barriers, trade barriers. I think probably the best way we could help is to lift these trade barriers. Brazil has done something interesting, particularly in HIV retroviral drugs, is that they started to produce a generic form of the drug, a much cheaper form without the patent, and that was considered illegal because there are IP protection laws. And these protection laws are in place to stimulate innovation. So they're not evil. It's just their implication sometimes gets twisted. So some countries, and India does this as well, just have been producing the drugs regardless and pretending or just ignoring IP, intellectual property. I think we should help, as a developed world, we should definitely not hinder a developing world, but we should also not be entirely responsible. And you need to find a balance in that. You can't just leave people to their own devices, but there also needs to be more trade between, for example, West African countries, because West African countries have enormous barriers between them. So why should all products go to Europe? Couldn't there be a sort of African version of the EU, for example? When it comes to health, sometimes you have a crisis like Ebola. When you have a crisis, you need help straight away, and that's one of the cases where aid is useful. Because the countries are not equipped to deal with such a virulent disease as Ebola. We today have an Ebola case in Spain that has been contracted in Europe. It's the first contraction of the disease outside of West Africa. It's very scary because she's been walking around for 10 days. Many people are going to get it. It's in Spain. It's a stupid mistake. It's happened. So you can see that even in the developed world where we think we've got all the solutions, it's not that easy. So it's interesting to see what will happen with Ebola. I think in the next 21 days we're going to see quite a few cases in Spain. And it's interesting to compare the reaction of West African countries to the reaction here in Spain. People are getting very nervous. The block where she lived is very, very nervous. They have a dog which they want to put down, and there's a petition with 200,000 votes to not kill the dog because, well, you know, animal rights. And then, but what if the dog has Ebola? Can dogs get Ebola? We don't know. We don't know. So, tricky question. Very good question. Not easy to answer. The solution usually lies in the middle, not extremes. But we need to think about how to make people help themselves as well.
Yeah, absolutely. Okay, well, I'll just go to the next question on the list since we have quite a lot to get through. So Eng has asked, do you believe there's the possibility of implementing a limit on the amount of children a family can have on a worldwide level? And is this beneficial to sustainability? And I guess the obvious example is in China, where they've, for a long time, I think they've relaxed it now, but they had the one-child policy, and I guess that also relates to the wider issue. You mentioned that it's a sustainable growth rate to have 2 children, but actually, is there any benefit to society to have actually a falling population due to a very low birth rate?
It's very difficult to impose than police. Ideally, if you had a magic wand and said, "All right, guys, everybody, 1 child," but how are you going to police that? How are you going to make sure that happens? China even struggled on that, and you get all sorts of funny outcomes. Like in China, it's better to have a boy. So a lot of people got pregnant, found out that it was a little baby girl, and somehow got rid of it. So now you've got a deficit in women, and you have men who can't find a partner, which is one of these cruel twists of nature. If you mess with it, it will mess with you. And you have to marry up. There's this term guanxi, the leftover women. If you're extremely educated and extremely rich, you cannot marry up, so you end up single. But there's just too few women now. So I don't think imposing a world limit to kids is going to work. But I do think people don't really want 5 children. If you look at religion and babies, this is another Hans Rosling statistic. Religion, people, first glance, including myself, thought that religion and babies was correlated, that certain religions tend to have more babies. Not true. The number of babies you have is correlated to wealth. If you can choose and you are educated, on average, of course, there's going to be people who have 3 and there's people who have 1, and there's people who have 5 and there's people who have none. But on average, we have 2 children when we can decide. That's sort of enough, apparently. So rather than imposing, I suggest it would be more productive to give people a scenario where they would choose to have 2. And that's also morally much more sound. People shouldn't be in miserable poverty. We have 1 billion people in miserable poverty. That needs to stop. Child mortality is something we can avoid. Children rarely die in developed countries. Why are kids dying? It's not necessary. So concentrate your resources.
Great, thanks. Well, you mentioned about about teaching people education. So Sar has asked about, do you think healthy food has to be a subject in schools, and or do we give the responsibility to the parents to discuss eating behavior? And then Jose has also asked about, is a vegetarian or vegan diet, is that more is that healthier? So I guess this links to the questions about diet, because you showed that photo with all the awful like processed food and everything. So whose responsibility is it to help people be eat healthier? Do you think?
Okay. Joint effort, family, governments. We need to feed our kids right. It's just not right to have obesity at age 5. And there's indications that we have obesity at age 6 months old. That's shocking, because that kid will live less years than it should have, and also less quality years. So this is a joint effort. When it comes to what is healthy, that's a very good question, because it's there's a lot of myth in food, a lot of myth. There's very few things that we know. If you study nutrition, it's complicated, because first of all you have to record what people eat. And if I ask you, what did you eat yesterday? You'll probably say, well, for breakfast I had this, and for lunch I had that, and then what was it? Oh yeah, for dinner I had that. Now I say, what did you eat last Tuesday? And that's a real struggle. And I'm talking about everything. That little snack at 5 o'clock, and the coffee, and, you know, everything. And then you ask, how much? And they'll say, oh, well, 1 portion. Now, what's a portion? What's normal to one person, another person? And then once you've figured out what people are eating, you have to look at what interacts with what. So you don't ever get one person who only eats fish. They eat many things, and it changes over their life. And perhaps it needs to change over their life. So nutrition is not an easy subject. There's a few things we do know. Red meat is correlated to cancer. Not only is it correlated to cancer, a higher incidence, it's very unsustainable to produce. For 1 cow, you need some stupid quantity of fields. We cannot have everybody eating the amount of red meat us rich people eat. It's not possible. There's a company in Holland that's trying to make insects fashionable to eat. That would be a solution. Very good protein, very pure. Fish, we need to sustainably fish, otherwise that's going to run out. But things like shrimps is also very good protein, and it's basically the insect of the sea. So red meat is a problem. Other meats, not so much. Chicken and stuff, and fish. There was a report in the 60s which was basically the beginning of our understanding about obesity, and it linked certain foods to obesity, and there was a lot of lobbying and pressure from the companies that produce these foods, and they changed the wording. So the result was that the industry started producing all these shadow products of lower fat, less fat, lower fat, no fat. There are certain fats that are bad for us. There are. Animal fat is not good for us. But there are other fats that are good for us. The fat in tuna is good for you. In quality, like the Greeks had it. You've got to get the quantity distributed and a little bit of everything. Don't go crazy on tuna just because you read one thing about tuna. So the industry put a lot of pressure. They produced all these sub-products about putting less fat. And to compensate, because when you take the fat out, it tastes dreadful, they put a lot of sugar. And now they're starting to talk about sugar as if it was cocaine. It lights up the same reward areas in the brain. Very similar. So they're starting to say that we're a nation addicted to sugar. And maybe we should start regulating it. because it's everything, it's very difficult to eat less sugar. There's a challenge, part of Fed Up, I think, or is it another one? Anyway, try not to eat sugar for 20 days. I did it. I lasted 2 days. It's hard. It's in everything, you know. It's disguised. It's in tomato sauce. It's in cereal. It's in all sorts of kids' products that are sold as healthy products. That's the worst thing. So then they started producing these sugar substitutes. Turns out those sugar substitutes also have negative health impacts, of course. Not a big surprise, but they seem to trigger diabetes. Perhaps, this is not confirmed, perhaps more quickly than normal sugar. They're also associated with some mental problems, but that's not confirmed either. But anyway, the substitutes are not good either. It's questionable whether that's better or worse. My suggestion on food is stick with the Greeks. A little bit of everything and not in excess.
Yeah, I guess following on from that, Patricia has asked about what she says, how can we fight with these big fast food companies like McDonald's that invest in marketing to encourage people to buy their products, which is, I mean, not just McDonald's. There are lots of companies who really benefit from people buying their relatively pretty unhealthy products. I guess what are the? I mean, we've talked about education. I mean, are there other steps that can be taken to sort of discourage people from buying unhealthy food? Because some people would argue that it should be left up to people to make the choice, and I don't know, government shouldn't be getting involved in regulation. That's one point of view.
The processed food companies are acting very much like the tobacco companies acted when tobacco started to be linked. Can you still hear me?
Yeah.
Hello?
Hi. Sorry.
No, it's fine. Yeah, so they're acting very much like the tobacco industry was acting when it started to be correlated to cancer. Yes, there's this free market thing that you shouldn't regulate, but do we really have free will? They target kids when you're susceptible to picking up habits. For example, when you go out at the checkout of the supermarket, there's that sort of sweet stuff, little bits and pieces rack. Have you noticed at what height that is? That's at child eye level, and that's not a coincidence. The way things are placed in the supermarket is not a coincidence. There's a lot of business and coordination into the distribution of food and the order in which people are presented, because it really impacts what you choose. If you have a counter and you get veggies first and then processed food, you'll fill up your plate with veggies. By the time you get to the processed food, you don't have space. So you need to you need to anchor the mind on healthy products and not unhealthy products, because it's an addiction, and especially when you target children, it's not fair. So I agree, you can't force people to eat this or that, but you can also trick people. We're wired to like fatty, sugary food, so it's very easy to sell on that basis. But there's a supermarket in Holland called Mart, and that just opened on the basis that it only sells healthy food, and it's quite a lot more expensive than regular. I can't shop there, which is not right either. It should not be that you get a class segregation and you judge people on what they eat. That shouldn't happen either. If you can intervene anywhere, it's in schools, in the canteens. Kids eat in canteens. So Jamie Oliver had a big push on this. Also got a fantastic TED worth watching. Schools, and yes, some regulation.
Yeah, so to answer Marie's question there, she's asked, would banning fast food from stores and restaurants make our society healthier and reduce the investment cost for governments in healthcare? You would say not just personal opinion. You don't think it would be you wouldn't ban completely. You wouldn't support an outright ban on this
Anybody
food,
who bans them is insane. It's very difficult to ban stuff. But you can do something called choice architecture, which is presenting the options to people in a slightly different order, and it really does affect the outcome. There's a few books on choice. There's a guy called Dan O'Reilly who's on TED, who's very public and very accessible. He's got something called Predictably Irrational, which looks at choice. There's Daniel Kahneman, who won the Nobel Prize. He has a book called Thinking Fast and Slow that also talks about choice. So the question is, I don't think banning is going to get us anywhere, but we can architect our choice.
Yeah, absolutely. It's amazing. It seems that people are really keen on asking questions about Ebola. I guess because it's so relevant and in the news.
Yes.
I keep on getting updates from the BBC or the Guardian saying, "Oh, Ebola, there's a new, or in Spain or whatever." Chirag has asked about how often can we expect an outbreak like Ebola, and there's a number of questions. I guess as a healthcare expert, how do you see the Ebola crisis or epidemic playing out and hopefully ending?
It's a nasty virus. It's very nasty. I think we underestimated it. It seems incredibly infectious and has a really neat. I mean, when viruses come out, as a scientist, there's always a little bit of me which gets excited about how clever it is at attacking us in this new way. It's a clever little virus. The way it's going to pan out depends on how we respond. We need to isolate people who get it, and very cleverly. And what happened recently in Spain was foolish and naive and didn't take it seriously enough. There's an astonishing rate of people who die who are medical workers. And people who contract it who are medical workers. So if you work with Ebola patients, those people need to be isolated as well. There needs to be a real containment of this virus. And that depends on us as a people being careful. You have to, the way you can track it, I went out today, and this might be crazy, but I bought a thermometer. The first symptom on Ebola is temperature. So if we can track our temperature, and because it's only infectious when you start displaying the symptoms, so if you track your temperature, and at the minute it starts going funny, contain those people, I'm certain we can do it. But there's going to be a few more deaths, and the slower we act, the more deaths there are going to be. The real trouble is that in West Africa, the infrastructure is not there in the same way as it is here. So they need help. And in this case, we need to help them to help ourselves. They need help. And it's very honourable that there's many doctors going there to deal with this. They also need equipment. The thing is, when you have a virus in a community, it's very difficult to contain, because if you get a temperature, how fast are you going to respond to that? If you're poor, you can't just not go to work. Even if you're relatively rich, sometimes you can't just not go to work. So it's difficult to contain. We have to be careful, and I suspect this won't be the last virus we see. I suspect there'll be more. I'm sure somebody's tried, but it's very difficult to predict how often they're going to come around. But we need to act together as a humanity on this. This is a test, basically, to how good we are at dealing with things as a world community. We need to really get together on this.
Okay, great. There are two final questions, maybe the most popular, because we're almost at the end of our hour. Well, firstly, you talked about the in West Africa not being able to respond so well to the crisis. Asa has asked about Canada's healthcare system. It's mostly free at the point of use, but it's provided by, most of the services are provided by private entities. Is there any, I guess maybe you don't have so much time to go into details, but do you know any, what maybe the students could look into countries with good examples of an effective public healthcare system?
Easy. Winners by far. National health system.
Where?
NHS.
Sorry? NHS? The UK.
The UK has a marvellous healthcare system, really. Fantastic.
I would agree. But yeah. And then, so finally, Eng's question is about, I guess it's going back to the marketing by companies, or manipulation, supposed manipulation of people. But maybe, do you have any suggestions for how we can encourage people to eat healthy? Like, what are some things that we could do ourselves to encourage people to eat more healthily and reverse the propaganda, as Ames put it?
Follow me. I'm working on this. I have a lot of opinions on this, and I'm trying to produce something that will shift reward so that we get paid to be healthy. At the moment, we're relying on education. I'd like to see a few financial incentives in the right places at the right time. So at the moment, we're relying pretty heavily on education, but I think it's time for our financial infrastructure to shift, and I'm working on that. Send me an email. I'm happy to talk about it more.
Yeah, great. Okay. Well, unfortunately, I'm afraid we've got so many more